why it sucked to be a medieval surgeon, and more, to the countless anonymous medieval patients whose suffering, though horrifically documented, remains largely unheard. May your agonizing tooth extractions, brutal amputations, and generally dreadful medical experiences at least serve as a darkly comedic cautionary tale for future generations. You endured the medieval equivalent of a root canal performed by a blacksmith wielding rusty pliers, a feat of stoicism worthy of a Viking saga, albeit with considerably less glory and far more pus. This book is dedicated to your resilience, your surprisingly high tolerance for pain, or perhaps a crippling lack of alternatives, and your unintentional contribution to the advancement of medical hygiene. To you, the unwitting pioneers of what we now call proper sanitation, a concept seemingly lost on your surgeons, I raise a sanitized, germ-free toast. May your souls find peace, free from the relentless and frankly terrifying advances of medieval medical science. And, let's be honest, your leeches probably deserved a better life. To them as well, a belated and equally sanitized farewell. It truly is astonishing, and perhaps a little hilarious, in a deeply unsettling way, to consider how far we've come. You endured things that make modern root canals seem like a spa day. It was a barbaric period in the history of medical practice, one that makes our modern medical world seem unbelievably sophisticated and advanced in comparison. Your sacrifice, though largely involuntary and accompanied by immense suffering, contributed to the development of modern surgical techniques. For that, if nothing else, you deserve this dedication. In the words of Monty Python, and now for something completely different, but still somewhat gruesome. Chapter 1: The Tools of the Trade and the Lack Thereof. The air hung thick with the scent of wood smoke, unwashed bodies, and something vaguely resembling burnt meat. Flickering candlelight cast long, dancing shadows across the cobbled floor of the makeshift operating theater, a converted stable, judging by the lingering aroma of hay and equine flatulence. This wasn't exactly the Mayo Clinic. In fact, it was several centuries and a chasm of medical understanding away from anything resembling modern surgical practice. Our protagonist, if you could even call him that, was Brother Thomas, a man whose surgical skills were perhaps best described as enthusiastically haphazard. His surgical kit, laid out on a trestle table, was a testament to medieval ingenuity, or the utter lack thereof. A rusty saw, its teeth dulled by countless, and likely unsuccessful, amputations, lay nestled beside a pair of pliers that looked more suited to extracting stubborn nails than teeth. Next to these instruments of questionable utility sat a collection of alarmingly blunt knives, their handles stained a disturbingly brownish hue, a palette of past procedures, one might say. And then, the pièce de résistance, a cauterizing iron, glowing ominously red from its recent sojourn in the hearth. Brother Thomas hummed a jaunty, if slightly off-key hymn as he inspected his tools, a serene expression on his face that belied the carnage about to unfold. Let's be honest, the instruments weren't exactly designed for precision. The saws were more akin to rusty bread knives, capable of slicing through bone with about as much finesse as a drunken lumberjack through a redwood. The pliers, God help the unfortunate soul whose teeth they were destined for, possessed a grip that would make even the most seasoned blacksmith envious. And the knives? Well, let's just say that the phrase blunt force trauma was not merely a figure of speech in this particular era. Brother Thomas, bless his cotton socks, believed in the power of brute force. The more forceful the application, the more effective the surgery, apparently. This was before the invention of the scalpel, a far more civilized instrument, much like a civilized society, something the Middle Ages were noticeably lacking. The cauterizing iron, however, held a special place in Brother Thomas's surgical arsenal. He considered it his magic wand, a device capable of stanching blood flow with the same efficiency as a medieval dam could stop a flood. While this was, to be kind, a gross oversimplification, its primary purpose was, in his words, to seal the wound, so to speak. The reality, however, often involved searing flesh with a red-hot piece of metal until it was charred black and sufficiently singed. It was certainly effective at cauterization, although its success rate in preventing infections was, well, less than stellar. But Brother Thomas's tools weren't just limited to the relatively straightforward, by medieval standards. His kit also contained a bewildering array of other implements. There were various spoons and scoops, ostensibly for removing pus and other unpleasantries from wounds, though their hygiene standards were as questionable as their efficacy. One particularly intriguing item was a long, slender probe with a spiral end, which Brother Thomas proudly proclaimed to be a worm extractor. Its actual use remains somewhat of a mystery, as the medical understanding of parasitic infections was, shall we say, lacking in the detail department. It was certainly capable of exploring the depths of a wound, much to the likely horror of the patient. The overall impression was one of a farrier's kit that had gotten into a fight with a blacksmith's forge. The contrast between these tools and the precision instruments used by today's surgeons is frankly staggering. Modern surgical procedures are performed with instruments that are not only exquisitely sharp, but also sterile, crafted from high-quality materials and designed for maximum precision. Microsurgery, laser technology, and robotic assistance are commonplace, allowing surgeons to perform complex procedures with an accuracy and safety that was entirely unimaginable in the medieval period. It's a difference between a blunt axe and a laser scalpel, a blacksmith's hammer and a neurosurgeon's scalpel, the difference between a flint and steel and a high-powered laser. Needless to say, it's a pretty remarkable evolution. Yet, amidst the rusted tools and the flickering candlelight, one could almost sense a certain grim determination. These were not the men who backed down from a challenge, even if that challenge involved attempting to repair a shattered tibia with a hammer and a prayer. They operated without anesthesia, their patients restrained by sheer force of will and a healthy dose of fear. There was no sterile field, no meticulous preparation, no understanding of asepsis. The surgeons worked in a miasma of blood, pus, and fear, their success rates likely far lower than even the most optimistic estimations. The lack of understanding of basic hygiene and infection control was a death sentence for many patients. Open wounds were left to fester, infections ran rampant, and post-operative complications were as common as freckles on a sunbather. Without a grasp of germ theory or even basic sanitation, surgeons inadvertently helped spread infections, transforming what may have been a treatable injury into a fatal sepsis. The very air itself seemed to be thick with the potential for lethal infection, yet the medieval surgeon pressed on, wielding his rusty tools with a strange mixture of confidence and ignorance. The medieval surgical experience, therefore, wasn't just about the tools, it was about the conditions in which they were used. It was about the absence of effective pain relief, the complete lack of hygiene, the rudimentary understanding of anatomy and physiology, and the pervasive presence of superstition and religious belief. It was a time when surgery was often a gamble, a last resort, and a testament to the incredible resilience of the human spirit in the face of unimaginable pain and suffering. Yet, through the grim humor and desperation, a sense of human determination shines through, reminding us that even in the most primitive of medical settings, hope, however naive, often prevailed. It's a story of brutal inefficiency, yes, but also of unexpected courage. And that's the darkly humorous truth of medieval surgery. The tools were crude, the conditions appalling, yet the human spirit endured, armed with little more than a prayer and a rusty saw. Let's delve into the practicalities, or rather the impracticalities, of medieval surgery. Forget the sterile gleam of a modern operating theater. Picture instead a dimly lit stable reeking of hay, sweat, and something akin to a week-old battlefield. The sounds are equally unsettling. The rasp of a rusty saw against bone, the muffled groans of the patient, or perhaps it's the groaning of the saws, and the rhythmic drip, drip, drip of blood, the soundtrack to a medieval horror show. One of the most popular, if that's the right word, procedures was bloodletting. Think of it as the medieval equivalent of a prescription for aspirin, only far less effective and significantly more gruesome. The tools of this particular trade were simple enough: a lancet, a sharpened blade designed to slice open veins with the precision of a blindfolded badger, and leeches. Yes, leeches. These slimy, blood-sucking creatures were considered miraculous, a natural remedy for almost any ailment, from headaches to the plague, which ironically they may have sometimes helped spread. The procedure itself was, well, let's just say it involved a lot of blood. The amount of blood removed was often determined by the surgeon's intuition or guesswork, guided by the vague belief that removing bad humors would restore health. The patient's feedback on this belief was understandably rarely solicited. The image of a medieval surgeon applying leeches, his face illuminated by candlelight, is a chilling reminder of a time when medical science was more faith than fact. The patient would often endure this process with nothing more than a prayer and a stiff upper lip, assuming they still had a stiff upper lip after the procedure. The aftermath frequently involved significant blood loss, sometimes leading to death, a far more effective remedy than initially intended, one might cynically observe. Then there were amputations. Imagine a limb mangled beyond repair. The surgeon, let's call him Bartholomew, because it sounds appropriately medieval, wielding a rusty saws that hadn't seen sharpening since the 100 Years' War. The patient, likely strapped to a crude wooden board, would endure the agonizing process with minimal, if any, pain relief. No elegant incisions here. This was a brutal hacking away of flesh and bone, a display of raw power and desperation. The surgeon's primary goal wasn't precision, it was speed. Infection was the ever present threat, so quick removal was paramount, even if the cut was less than refined. Post operative care often involved cauterizing the wound with a red hot iron, sealing the ravaged flesh shut like a carelessly made pie. A small mercy, perhaps, compared to leaving it open to the elements. However, such practices were largely ineffective against infection. The survival rate was, shall we put it mildly, dismal. Amputation was a lottery, and the odds were heavily stacked against the unfortunate player. Setting broken bones was another delightful experience. Forget the precise alignment and casting techniques of modern orthopedics. Medieval bone setting frequently involved a combination of brute force, dubious herbal remedies, and fervent prayer. The surgeon might attempt to realign the fractured limb, employing tools that would make a blacksmith blush. The patient, meanwhile, would be subjected to pain that defies description. No anesthesia, of course, only gritted teeth and muffled cries. The resulting alignment was often suboptimal, leaving the unfortunate patient with a limb that was permanently crooked, shortened, or otherwise dysfunctional. Such was the case with many things in this pre-antiseptic era. And let's not forget dental work. Tooth extractions were a particularly memorable event, mainly for the person having their teeth extracted. The tools of choice? A pair of pliers, typically less refined than those used by a mechanic fixing a bicycle. No local anesthetic, just raw, agonizing pressure as the tooth was wrestled from its socket. This often resulted in broken teeth, damaged gums, and a fair bit of blood. It's easy to imagine the cries of the patient echoing through the grimy operating room, a truly unpleasant sound, even for the most hardened medieval surgeon. The absence of any germ theory meant infections frequently followed, extending the discomfort well beyond the immediate procedure. Oral hygiene, or indeed any form of hygiene, was a luxury these patients certainly didn't have. The entire process, from preparation to recovery, was a testament to human resilience and a rather frightening lack of medical knowledge. There were no antiseptic techniques, no sterilization, and certainly no understanding of the role of bacteria in infection. The air was thick with the stench of infection. The tools were crude and often contaminated, and yet the medieval surgeons continued their work, driven by a mixture of conviction and sheer ignorance. Their patients, meanwhile, endured excruciating pain, often facing a grim prognosis, a testament to the bravery, or perhaps the desperation, of those who lived in times past. This was a world where the line between surgery and torture was blurred to the point of non-existence, a time when survival was a matter of luck, resilience, and the unpredictable whims of fate. It wasn't surgery as we know it today, not by a long shot. It was a grim, brutal, and often comical affair. Comical in the darkest sense of the word, of course. The sheer audacity of these procedures, the stark contrast with modern medicine, is a testament to the incredible advances made in medical science, advances that make the practices of our medieval predecessors appear as something between a macabre joke and a horrifying tragedy. The legacy of their attempts, however flawed and frightening, is a stark reminder of how far we've come and a healthy dose of gratitude for the advancements in medical care that we enjoy today. Let's leave the blood-soaked operating tables, or rather hay-strewn floors, behind for a moment and step into the hallowed halls, or perhaps more accurately, the musty, dimly lit libraries of medieval universities. Here, amidst the scent of aged parchment and the occasional stray rodent, we'll explore the science that undergirded those astonishingly crude surgical procedures. The word science is used loosely, of course. What passed for medical understanding in the Middle Ages was a fascinating blend of genuine observation, albeit highly flawed, ancient Greek theories, and a hefty dose of pure superstition. The cornerstone of medieval medical thought was humoral theory, a concept inherited from ancient Greece and refined, or perhaps mangled, over centuries. This theory posited that the human body contained four humors: blood, phlegm, yellow bile, and black bile. These humors were believed to be in delicate balance, and illness was seen as a disruption of this balance, an imbalance of humors. Too much blood, for example, could lead to a plethora of ailments, ranging from fevers to a general feeling of being rather oversanguine. The solution? Bloodletting, naturally, a procedure we've already encountered, but now we understand its theoretical underpinning, or rather, its theoretical justification. This theory, while completely unfounded by modern standards, governed virtually every aspect of medieval medical practice. Diagnosis wasn't a matter of examining symptoms or conducting tests. It was largely a matter of assessing a patient's complexion, temperament, and general demeanor to determine the dominant humor causing their ailment. A ruddy complexion might suggest an excess of blood. A pale, sluggish individual might be suffering from an imbalance of phlegm. The treatment, then, focused on restoring the balance, often through methods that would make a modern physician faint dead away. Remember those leeches? Perfectly aligned with the theory of humoral imbalance, a natural solution to draw off excess blood. Now, let's consider miasma theory, another dearly held belief of the era. This theory suggested that diseases were caused by bad air, noxious fumes emanating from swamps, decaying matter, or even just generally unpleasant environments. The smell, naturally, was the key indicator. Hence, the often appalling sanitary conditions of medieval cities weren't just a matter of inconvenience. They were believed to be the cause of disease. This understanding, or rather misunderstanding, shaped not just medical theory, but also the very layout of towns and cities. The stench of the streets wasn't just bothersome, it was a deadly miasma, a silent killer stalking the unwary. The implications for surgery were significant. In a world where disease was believed to be airborne or spread through bad air, the concept of sterile surgical techniques was entirely alien. Why sterilize your tools when the air itself is the problem? The idea of washing hands, let alone sterilizing instruments, was not even on the radar of these physicians. Their efforts primarily focused on purging the bad humors and dealing with obvious wounds, oblivious to the role of unseen pathogens. Beyond humoral theory and miasma theory, superstition and religious beliefs played a significant role in shaping medical practice. Many medieval physicians relied on prayers, charms, and amulets to aid in healing, often incorporating them into their treatments alongside more conventional, for the time, procedures. The perceived supernatural dimension of healing wasn't viewed as separate from medical treatment. Rather, it was integral to it. A successful operation wasn't simply a matter of surgical skill, it was also a testament to divine favor or the efficacy of a particular holy relic. This intermingling of the sacred and the medical made it extremely difficult to objectively assess the success or failure of a given procedure. How could you possibly isolate the effect of the prayer from the effect of the leeches? The lack of understanding of anatomy further hampered surgical practices. Dissections were rare and heavily restricted, largely due to religious objections. Detailed anatomical knowledge, therefore, was severely limited, relying on ancient texts and occasional clandestine dissections. This lack of precise anatomical knowledge meant that surgeons often worked blindly, lacking a deep understanding of the structures they were manipulating. Imagine performing an amputation without a clear understanding of the location of major blood vessels and nerves. A recipe for disaster, to put it mildly. The absence of anesthesias makes the sheer audacity of medieval surgery all the more remarkable. Patients endured excruciating pain during procedures, their suffering often compounded by the lack of effective pain relief. It's impossible to comprehend the agony these individuals endured and the resilience they must have demonstrated to survive such procedures. Their perseverance is a testament to their fortitude, not an endorsement of the practice. One might even describe it as a darker sort of heroism. The lack of effective antiseptic techniques compounded the problem. Infections were a major cause of mortality following surgery. Wound infections, gangrene, and sepsis were commonplace, often proving far more lethal than the original injury. The absence of any germ theory meant that surgeons were unaware of the fundamental causes of infection and therefore powerless to prevent it. Their methods, even when intended to help, actively harmed their patients. This makes their efforts all the more poignant, a tragic demonstration of good intentions gone awry due to a profound lack of understanding. The contrast between medieval and modern surgery is stark and frankly hilarious in its absurdity if you're able to find humor in the face of such immense suffering. Where we now have advanced imaging techniques, precise instruments, sophisticated anesthesia, and sterile operating rooms, they had rusty tools, limited anatomical knowledge, agonizing pain, and a profound reliance on sheer luck and prayer. The story of medieval surgery is a fascinating, if gruesome, testament to human ingenuity, resilience, and the remarkable progress of medical science. It's a story of profound misunderstanding masking well-meaning attempts to help, attempts that, unfortunately, more often than not, ended up as a grim reminder of how far we've come. The sheer audacity of it all remains, however, a source of both horror and strangely morbid amusement. The absence of anesthesia in medieval surgery is perhaps the most chilling aspect of the entire enterprise. Imagine, if you will, having a leg sawed off, a tooth yanked out with rusty pliers, or a gaping wound stitched shut, all without the benefit of even the most rudimentary pain relief. The sheer audacity of it is almost comical, were it not for the unspeakable suffering involved. While we may chuckle darkly at the primitive tools and misguided theories The reality of enduring these procedures without any form of pain management is truly horrifying. The medieval approach to pain management was, to put it mildly, inadequate. There was no ether, no chloroform, no laughing gas. Instead, surgeons and their patients relied on whatever meager remedies were available, often with limited success and frequently disastrous side effects. The most common options were alcohol in varying strengths and forms, and opium, a potent but unpredictable narcotic. The effectiveness of these substances was highly variable depending on the individual's tolerance, the quantity administered, often a matter of guesswork, and the sheer brutality of the procedure itself. A swig of watered down wine might dull the edges slightly for a minor procedure, but it would offer little solace during a major amputation. Opium, while more potent, carried its own risks, from respiratory depression to unpredictable side effects that could complicate the surgery further. Consider the battlefield surgeon, a grim figure amidst the carnage. Amputations were commonplace, often performed with little more than a rusty saw and a prayer. The patient, typically already weakened by blood loss and shock, would be given perhaps a dose of alcohol, if there was any to spare, and then held down by assistants, their screams swallowed by the din of battle. The surgeon would work quickly, driven by necessity and a grim determination to save as many lives as possible, even if this meant inflicting unimaginable pain in the process. The scene was a brutal ballet of blood, sweat, and agony, a far cry from the sterile precision of a modern operating room. In a less chaotic setting, say within the confines of a church or a monastic infirmary, the procedure might have been slightly more controlled, though hardly more pleasant. Patients, often tied to a crude operating table, might have been offered some form of alcoholic beverage or a dose of opium, a pathetic attempt at pain relief that probably did little to numb the excruciating pain of the scalpel, the saw, or the forceps. The setting, while ostensibly more sanitary than the battlefield, was still far from sterile. The air, thick with the smells of herbs, incense, and unwashed bodies, did nothing to alleviate the miasma of fear and dread that pervaded the room. The methods of restraint were as rudimentary as the anesthesia. Strong assistants, ropes, or even simple wooden boards might be used to hold the patient still. Imagine the sheer terror of being strapped down, unable to move, as sharp instruments sliced and tore into your flesh. The cries of pain would have echoed through the room, a testament to the inhumanity of it all. The patient's resilience and fortitude in enduring these procedures without any effective anesthesia are nothing short of remarkable, highlighting both the limitations of the medical practices and the astounding capacity of the human body and spirit to endure unimaginable pain. The lack of effective anesthesia highlights a fundamental difference between medieval and modern surgery: the relationship between the surgeon and the patient. In modern surgery, there is a concerted effort to minimize pain and distress. Anesthesia is a vital part of this effort, creating a safe and controlled environment where the surgeon can focus on the procedure without causing unnecessary suffering. In the medieval world, this simply wasn't the case. Pain was an intrinsic part of the process, an unavoidable consequence of surgical intervention. The surgeon's focus was primarily on survival, on patching up the wound, stopping the bleeding, and hoping for the best, not on comfort or pain relief. It wasn't just the lack of potent anesthetic agents, it was also the lack of understanding of the physiological effects of pain. Medieval physicians had little comprehension of pain pathways, pain receptors, or the intricate neurochemical processes that govern our experience of pain. Their attempts at pain relief were largely based on empirical observation, trial and error, and a healthy dose of wishful thinking. The lack of a scientific framework for understanding pain contributed significantly to the inadequacy of their pain management techniques. The stories of medieval surgery, stripped bare of romanticized notions, are horrifying tales of resilience and suffering. They serve as a stark reminder of how far medical science has progressed, of the advancements that have made modern surgery a far safer and less painful experience. The advancements in anesthesia, antiseptic techniques, and a deep understanding of human anatomy are not mere technical achievements. They are vital contributions to the well-being of patients, a testament to humanity's relentless pursuit of alleviating suffering and improving human life. The laughter, if any is to be had, lies in the darkly ironic juxtaposition of the primitive tools and desperate methods used against the monumental task of relieving pain, a task they ultimately failed, revealing the brutal reality of medieval surgery. The contrast between the brutality of medieval surgery and the relatively painless procedures of modern surgery cannot be overstated. The medieval surgeon, working with limited knowledge and rudimentary tools, operated in a world where pain was a constant and inescapable companion. Today, surgical patients are often sedated and monitored carefully, ensuring their comfort and minimizing their pain. The difference between the two worlds is not just a matter of technology, it's a matter of philosophy, a shift in perspective that places patient well-being at the center of medical practice. The advancements in anesthesia are not just an improvement in technique, they represent a fundamental change in the relationship between the physician and the patient, one that prioritizes human dignity and minimizes suffering. While the lack of effective anesthesias casts a long shadow over the practices of medieval surgery, it also reveals something profound about the human spirit. The individuals who underwent these brutal procedures without any modern pain relief demonstrate an extraordinary capacity for resilience and endurance. Their ability to withstand unimaginable pain speaks to the strength of the human will and the remarkable adaptability of the human body. Their suffering serves as a powerful reminder of the progress we have made and the importance of continued advancement in medical science, a constant quest to improve the human condition and reduce the suffering inflicted by disease and injury. The absence of anesthesia, therefore, becomes not just a symbol of medieval limitations, but also a testament to the tenacity and fortitude of those who endured the unimaginable. The dark humor is found in the fact that the sheer audacity of such practices, juxtaposed with the incredible capacity of the human body to withstand the pain, remains a constant source of fascination and perhaps a morbid sense of wonder. The absence of anesthesia was only one horror show in the medieval operating theater. The appalling lack of hygiene was another, perhaps even more impactful act in this gruesome drama. Forget gleaming stainless steel and sterile environments. Picture instead a room thick with the smells of sweat, unwashed bodies, and something vaguely reminiscent of a week-old fish market. The air hung heavy with the miasma of disease, a potent cocktail of bacteria, viruses, and who knows what else, patiently awaiting its chance to infect a freshly opened wound. Sterilization, as we understand it, was a concept utterly alien to medieval surgeons. The very idea of meticulously cleaning and disinfecting instruments before use would have seemed laughably excessive, if not downright heretical. Instruments, often crudely fashioned from readily available materials, like iron or bone, were typically wiped down, perhaps, with a rag, reused countless times between patients, accumulating layers of dried blood, pus, and other assorted bodily fluids. Imagine the cheerful surgeon reaching for his favorite sauce, its teeth caked with the remnants of previous operations, a charming reminder of his past triumphs, or more accurately, a veritable petri dish of infectious agents. The concept of a sterile field, the carefully demarcated space where surgical procedures are performed in modern operating rooms, was of course non-existent. Surgeons, assistants, and the patient themselves were frequently covered in dirt, grime, and bodily fluids. Robes, when used, were often worn for days on end, carrying their own distinct aroma and vast collection of microorganisms. Gloves, an unheard of luxury. The surgeon's hands, likely already carrying a multitude of bacteria from his daily activities, would delve directly into the patient's wound, happily spreading any and all infections already present. The operating table itself was hardly a paragon of hygiene. It might be a simple wooden plank, a rough-hewn stone slab, or even just the floor. Its surface, usually stained with the blood and other effluvia of previous procedures, was seldom cleaned thoroughly, if at all. And the patients, well, let's just say that a thorough bath before surgery was not a standard part of the preoperative preparation. The patient, frequently already weakened by illness or injury, often arrived at the operating table covered in dirt, sweat, and whatever else they'd accumulated in their daily life. The consequences of this shocking disregard for hygiene were unsurprisingly catastrophic. Post-operative infections were rampant, turning what might have been a survivable wound into a death sentence. Gangrene, a dreaded complication caused by bacterial infection, was a common occurrence, leading to the amputation of limbs or, in the worst cases, death. Sepsis, the overwhelming and often fatal response of the body to infection, was a frequent visitor in the medieval operating theater. The lack of antibiotics meant that once an infection took hold, it was often a race against time, with the odds heavily stacked against the patient. Let's consider a typical procedure, perhaps a simple amputation. The patient, already in agony from the lack of anesthesia, is laid on the crude operating table, his or her clothes stained with dirt and blood. The surgeon, his hands far from clean, begins the gruesome work. The saw, a rusty, inefficient instrument, cuts through bone and muscle, sending sprays of blood into the air, landing on the surrounding area, the assistants, and undoubtedly the surgeon himself. The wound, now gaping and raw, is an open invitation to any and all bacteria lurking nearby. The stitching, performed with a needle probably not much cleaner than the saw, further contaminates the wound, and the subsequent lack of proper wound care increases the likelihood of infection. And this wasn't just a problem in major surgical procedures. Even minor interventions, like the extraction of a tooth, could lead to deadly infections. The pliers, likely rusty and smeared with who knows what from previous uses, would tear through gums and tissue, leaving a raw, bleeding wound prone to infection. The lack of antiseptic techniques meant that these seemingly minor procedures could have life-threatening consequences. Medieval oral hygiene was, to put it mildly, less than stellar. Tooth decay and gum disease were incredibly common, meaning that any dental procedure was working with a pre-existing infection. The stench in these operating rooms must have been almost unbearable. The combination of blood, pus, decaying organic matter, and unwashed bodies created an atmosphere thick with the smell of death. The lack of proper ventilation would have made the situation even worse, trapping the noxious fumes inside and creating a perfect breeding ground for bacteria. This wasn't just unpleasant, it was a significant factor in the spread of infection. The air itself acted as a vehicle for disease, carrying bacteria from one patient to the next, ensuring a consistent flow of misery. The societal context further compounded the problem. Medieval society had limited understanding of germ theory, the concept that microscopic organisms could cause disease was still centuries away from general acceptance. Instead, diseases were often attributed to miasma, bad air, or an imbalance of the four humors: blood, phlegm, yellow bile, and black bile. This lack of understanding meant that there was no impetus for developing or implementing hygiene practices. Cleanliness in the medieval world was more a matter of aesthetics and social status than of preventing disease. Imagine the scene: a dimly lit room, the air thick with the stench of decay, a patient screaming in agony, and the surgeon, covered in blood and grime, working feverishly with his contaminated tools. The grim reality of medieval surgery was not simply the lack of advanced techniques. It was the horrifying combination of those techniques with a total disregard for basic hygiene. It was a perfect storm of pain, infection, and death, a testament to the primitive state of medical knowledge and practice during the Middle Ages. The dark humor here lies in the juxtaposition of the serious attempts at healing with the utter disregard for the most basic safety standards, which rendered those attempts, in many cases, more harmful than helpful. It's a horrifying testament to the resilience of the human body and spirit that anyone survived. Furthermore, the lack of understanding extended beyond germ theory. It included a fundamental lack of knowledge about wound care. Post-operative care was often rudimentary, consisting of little more than applying herbs or poultices to the wound, which frequently ended up doing more harm than good, introducing more infections into already compromised areas. The absence of proper dressings and bandages only exacerbated the problem, leaving wounds exposed to the elements and to the ever-present risk of contamination. Drainage, essential for preventing the buildup of pus and other infectious material, was rarely managed effectively, further increasing the likelihood of sepsis and other fatal complications. The stark contrast between medieval surgical hygiene, or the shocking lack thereof, and modern surgical practices is a testament to the advancements in medical science. Modern operating rooms are meticulously cleaned and sterilized, creating a virtually bacteria-free environment. Surgical instruments are thoroughly cleaned and often sterilized using high-heat autoclaves or other advanced methods. Surgeons and their assistants wear sterile gowns, gloves, and masks, minimizing the risk of cross-contamination. Antiseptic techniques, post-operative care, and a deep understanding of infection control have dramatically reduced infection rates, transforming surgery from a life-threatening gamble to a relatively safe procedure. The stories of medieval surgical hygiene, or rather the lack of it, are not just morbidly fascinating. They serve as a humbling reminder of how far medical science has come. The progress in hygiene is not just a matter of technical improvements. It represents a fundamental shift in understanding and approach, a move from a world where disease was often viewed as a divine punishment or an imbalance in the body to one where prevention and control are paramount. The darkly comedic aspect arises from the incredible contrast between the medieval surgeon's best efforts, valiant but ultimately futile, and the modern equivalent with its sophisticated technology and understanding of basic hygiene. The journey from crude saws and dirty instruments to laser scalpels and sterile environments underscores the importance of scientific progress in improving human health and well-being, proving once again that laughter, even black humor, can be found in the face of the grim realities of history. Chapter 2: The Patients, More Than Just Bodies. The chilling reality of medieval surgery wasn't confined to the operating theater itself. It extended to the patients themselves, a diverse tapestry of individuals whose experiences were profoundly shaped by their social standing. The stark inequalities of medieval society mirrored and often magnified the disparities in medical care. While the wealthy might have enjoyed slightly less appalling conditions, a relative term to be sure, everyone, regardless of rank, faced the same terrifying odds in the face of disease and injury. Let's start with the aristocracy. The nobility, with their access to resources and occasionally slightly more learned practitioners, didn't exactly enjoy a spa-like surgical experience. Think of their hospitals as more upscale versions of the peasant hovels, perhaps with slightly less vermin and marginally cleaner, relatively speaking, linen. But even for the elite, the absence of anesthesia, the primitive instruments, and the appalling hygiene remained constant threats. A nobleman's wound, while perhaps treated with slightly more expensive herbs and bandaged with slightly finer fabrics, was just as vulnerable to infection as a peasant's. Their supposedly superior treatment offered a mere sliver of improved chance of survival, but the grim reaper still lurked in the shadows. The accounts of aristocratic treatments, though sparse, often depict a bizarre blend of elaborate rituals and horrifying practices. Imagine a noblewoman suffering from a debilitating illness being subjected to a bloodletting ritual performed with ornate, yet still undeniably unclean instruments. The very act of being treated, even amidst relative luxury, was still an exercise in enduring unimaginable pain and risking potentially fatal complications. The medieval doctors sometimes used leeches, believing the blood-sucking creatures drew out bad humors, a notion that would make even a modern-day vampire cringe at its absurdity. The process, while potentially slightly less physically painful than an amputation, offered little actual therapeutic value. The wealthy may have had more access to such treatments, but often it only meant a more drawn-out suffering. Moving down the social ladder, the plight of the peasant becomes even more stark. Access to any kind of medical attention was often a matter of sheer luck or the kindness of a village healer whose skills were frequently limited to herbal remedies and prayers. A broken bone might be set with splints fashioned from whatever was at hand, a bit of wood perhaps, or even a tightly woven strip of cloth, and then left to heal as best it could. Infections were rampant, amputations were commonplace, and survival was often a matter of sheer will and resilience. For the peasantry, surgery was a last resort, often undertaken when the injury was so severe that it left no other option. A simple cut could become a death sentence when coupled with a lack of sanitation and access to even basic wound care. Life was brutal, and illness or injury was only another layer of hardship. The setting itself played a crucial role in shaping the experience of the patient. Imagine the stark contrast between a dimly lit, drafty castle room where a nobleman might be treated, and a dark, cramped peasant hut where a villager might have to deal with an infection or injury on their own, or with the limited assistance of a local healer whose knowledge was largely anecdotal. The lack of basic sanitation was ubiquitous. The very air was thick with the smell of decay, disease, and unwashed bodies, adding another layer of misery to an already grim situation. Castle surgeries, while marginally less squalid than their peasant counterparts, were still far from sterile. The surgeon, likely the castle's barber surgeon, a dual role that perfectly encapsulates the era's attitude toward medicine, would have a limited selection of tools, likely repurposed from blacksmithing or other tasks, and not always cleaned effectively between uses. The lack of antiseptic methods meant that even seemingly minor procedures carried a high risk of infection. The noble patients were subjected to bloodletting, often without the appropriate precautions. They might have finer linens, but that didn't safeguard them from the ever-present threat of infection. The peasant's experience was even more dire. The village healer, often a woman with a rudimentary understanding of herbs and remedies, relied on traditional practices, including prayer, herbal treatments, and whatever tools she could gather. Amputations, when absolutely necessary, would be performed with primitive instruments, often in unsanitary conditions. The post-operative care was rudimentary at best, usually consisting of crude dressings and herbal applications that rarely prevented the inevitable onslaught of infection. Survival was a matter of luck, resilience, and perhaps a touch of divine intervention. The gender of the patient also played a significant role. Women, often relegated to the domestic sphere, lacked the same access to medical care as men. Their illnesses and injuries were frequently treated at home, with minimal access to even the most basic medical attention. Midwives, while skilled in their practice of delivering babies, often lacked the resources or knowledge to deal with more complex medical issues. Pregnancy and childbirth were incredibly dangerous, and the high mortality rate for mothers and infants further underscores the inequalities of the era. The absence of formalized hospitals as we understand them, further complicated the situation. While some monastic orders and wealthy individuals might have maintained rudimentary medical facilities, the majority of the population had no recourse but to rely on the limited skills of local healers or their families. Travel to these makeshift facilities was difficult and dangerous. The journey itself could introduce further complications or even prove fatal. A broken leg, for example, could turn deadly if the patient couldn't reach proper relative treatment in time. The limited knowledge of basic anatomy further contributed to the challenge faced by medieval practitioners. They operated with an incomplete understanding of human physiology, leading to often futile attempts at healing. Even the urban environments of the medieval period offered little solace. Cities, while bustling with activity, were also rife with disease and squalor. The crowded living conditions meant the transmission of diseases was rampant. Simple wounds could quickly become infected. The lack of sanitation and the presence of rats and other vermin only made matters worse. Hospitals, where they existed, were often little more than overcrowded and disease-ridden places. A patient entering a hospital might face the horrifying reality of being placed amongst others, many suffering from severe infections. The risk of catching something new during the treatment was a severe concern. The social spectrum of suffering during the medieval period was vast and intricate. While the wealthy may have enjoyed somewhat better, though still utterly horrific conditions, the reality for all patients was grim. The combination of primitive instruments, lack of anesthesia, total disregard for hygiene, and the limited understanding of medical practices meant that seeking treatment was often a high-stakes gamble, with the odds heavily stacked against the patient, regardless of social status. The darkly humorous element arises from the sheer absurdity of it all, the stark juxtaposition between the valiant, albeit often misguided, efforts of medieval practitioners and the catastrophic consequences of their lack of knowledge and resources. The survival of anyone at all remains a testament to the resilience of the human spirit, and perhaps a little bit of dumb luck. The stench of wood smoke and unwashed bodies clung to Alara like a shroud. She clutched her rosary beads, the rough wood a comfort against the icy fear gnawing at her insides. The village healer, a wizened woman named Agnes, had declared her ailment, a festering wound on her leg, the result of a fall beyond her meager skills. The only recourse, Agnes had whispered, was the traveling barber surgeon, a man rumored to be more butcher than healer. Ilara, a devout woman, found solace only in her faith, praying for divine intervention, for the strength to endure whatever horrors awaited. Her fatalism, born from a lifetime of hardship, offered a strange kind of peace. She had lived a hard life, and death, she supposed, was merely another chapter in its relentless narrative. Her journey to the marketplace, where the barber surgeon set up his makeshift operating table, was a pilgrimage of dread. The air thrummed with the cacophony of a bustling village, the bleating of sheep, the hawking of vendors, the laughter of children. Yet to Alara, it sounded like a death knell. She passed by other patients, their faces a mask of stoic resignation, their expressions ranging from the dull apathy of fatalism to a desperate, terrified hope. A young boy, his leg bound in crude bandages, whimpered softly. His mother, her face etched with sorrow and fear, muttered prayers under her breath. A wealthy merchant, his face pale but set in grim determination, showed no outward sign of fear, but the tremor in his hand betrayed his inner turmoil. The marketplace, usually a place of vibrant life, was today a macabre antechamber to a gruesome spectacle. The barber surgeon, a burly man with hands calloused from years of wielding knives and razors, paid Ilara little attention, his eyes scanning her wound with the detached expertise of a butcher assessing a carcass. He spoke little, his gruff commands punctuated by the metallic clang of his tools, rusty scalpels, crude saws, and pliers that looked more suited to extracting teeth from a mule. He made no attempt to offer anesthesia, save for a mug of watered-down ale, a poor substitute for anything resembling pain relief. The whispers of the onlookers, hushed but palpable, were a chorus of prayers and morbid curiosity, a constant reminder of the precariousness of her situation. Ilara's faith, however, did not waver. She closed her eyes, murmuring prayers as the searing pain pierced through her pleas for divine grace mixing with the barber surgeon's curses. The agony was intense, excruciating, a symphony of raw, physical suffering, a reminder of the brutality of the era. There was no comforting hand, no reassuring voice, just the metallic scrape of steel against bone, the rough touch of the unclean instruments, and the constant gnawing fear of infection. The belief in the efficacy of the treatment was minimal, the focus being on survival against all odds. In contrast, Thomas, a young nobleman suffering from a shattered arm, had a vastly different experience. His treatment, while still brutal, took place in the sterile, yet still decidedly unclean, confines of his family's castle. He was attended by a more learned physician, a man who, while still operating with primitive instruments, at least possessed a slightly more refined understanding of human anatomy. Thomas, however, lacked Ilara's faith. His fear was not tempered by religious conviction, but fueled by a sophisticated awareness of mortality. His fear amplified by his knowledge of the potential fatal consequences, the knowledge that his chances of survival depended largely on luck and the rudimentary skills of the surgeon, filled him with cold dread. His cries of agony were muffled by velvet cushions, but the pallor of his skin, the tremor in his voice, revealed the terror gripping him. Even with what passed for superior care, Thomas's sense of fatalism was not assuaged. He knew the high-stakes gamble he was making, his life hanging precariously in the balance. Meanwhile, in the hushed sanctity of a monastery, Brother Benedict, a monk tending his herb garden, faced a different kind of struggle. His affliction, a mysterious ailment weakening his body, could not be treated by any conventional means. His faith in God, although strong, was intertwined with a deep-seated acceptance of God's will. He felt no particular terror before death. His fear was more of the unknown. He accepted the possibility of death as a natural part of life's unpredictable journey. His days were spent in contemplation, his fear replaced by a quiet resignation, a serene acceptance of his fate, his death being seen not as an ending, but as a transition. His faith was his strength, his resilience a testament to the spiritual fortitude found in quiet contemplation. The common thread binding these three vastly different experiences was a shared, unavoidable encounter with pain and the ever-present threat of death. Yet, despite the stark realities of medieval surgery, the primitive tools, the lack of anesthesia, the rampant infections, their reactions were profoundly shaped by their social standing, their religious beliefs, and their individual personalities. Ilara's unwavering faith, Thomas's intellectual fear, and Benedict's peaceful resignation illustrate the diversity of the human response to suffering. Each patient, in their own way, demonstrated the extraordinary resilience of the human spirit in the face of unimaginable hardship. Their stories, though vastly different, were all testaments to the power of faith, fear, and the surprising ability to find peace amidst the horror of medieval medicine. Their reactions, a microcosm of human nature, speak volumes about the fortitude and courage that allowed some to survive, while others yielded to the grim reality of the times. The medieval world, with its often absurd medical practices and the patient's strikingly diverse reactions, reveals a haunting yet fascinating glimpse into the human condition. The blend of fear and faith, resignation and hope, makes these stories not just historical accounts, but poignant explorations of the human experience itself. The stench of childbirth, a far cry from the wood smoke and suppurating wounds of the marketplace, hung heavy in the air. It was a cloying sweetness, tinged with the metallic tang of blood and the acrid bite of fear. Unlike the calculated dread of the barber surgeon's blade, the fear surrounding childbirth was a pervasive, gnawing anxiety, a constant companion for women throughout the medieval world. For while the men faced the risks of battlefield wounds and brutal surgeries, the women faced a different kind of horror, one that often claimed their lives before they even reached middle age. Ilara's experience, while horrific in its own right, paled in comparison to the relentless threat that loomed over every pregnant woman. The midwife, a woman whose knowledge was a blend of practical experience and superstition, knelt beside the laboring woman, her hands calloused and strong, yet trembling slightly. The birthing room, a dimly lit chamber within a humble cottage, was a chaotic tableau of frantic activity. The air was thick with tension, punctuated by the woman's cries, a primal symphony of pain and exertion that echoed through the small dwelling. Unlike Thomas's relatively sterile, if still crude, surgical environment, or even Brother Benedict's peaceful monastery, childbirth took place in an environment rife with infection. The lack of sanitation, the pervasive dirt, the constant presence of animals, all contributed to a heightened risk of infection, often leading to fatal consequences for both mother and child. The tools of the midwife were rudimentary at best. A few cloths, herbs, and perhaps a sharp knife or shears, sterilized only by the hope that the gods were feeling benevolent. The mortality rate was staggering. For every child successfully brought into the world, a significant number of mothers perished in the process, victims of puerperal fever, hemorrhage, or any number of other complications that the medieval understanding of medicine was wholly unequipped to address. Death in childbirth was a commonplace tragedy, accepted with a grim resignation bordering on numbness. Women were seen to be expendable, their lives deemed less valuable than those of men. Their value was inherently tied to their reproductive capacity. A childless woman in many cases was regarded as a failure. Consider the plight of Agnes, the village healer. Her own mother had died giving birth to her youngest sister, an event that had profoundly shaped her worldview. She viewed childbirth as an inherently dangerous, almost supernatural ordeal. While her knowledge of herbs and remedies might have offered some limited comfort, she had little to offer against serious complications. She had witnessed too many deaths, too many harrowing scenes of suffering, to have any illusions about the benevolence of fate when it came to birthing. The women of the village sought her wisdom, but ultimately, the outcome remained a matter of chance and divine favor, an uncomfortable mix of pragmatism and fatalism. A stark contrast to Agnes's village practice was found in the convents. There, the nun midwives possessed a somewhat greater degree of understanding regarding basic hygiene and birthing practices, though their resources were far from abundant. Their practices were still guided heavily by religious beliefs, their interventions a complex tapestry of faith and rudimentary medical knowledge. Still, the risks remained immense. The death of a mother during childbirth within the hallowed walls of a convent represented a profound spiritual crisis, though it certainly was not unheard of. The sanctity of the location did little to improve the situation, highlighting the pervasive nature of the threat. In the aristocratic circles, the experience differed slightly, not necessarily in the outcome, but in the surroundings. Thomas's mother, Lady Eleanor, had been attended by several midwives, and the birthing room in the castle was comparatively cleaner and more spacious. However, even with such advantages, the inherent dangers of childbirth remained the same. The risk of infection, the possibility of hemorrhage, and the sheer agony of the birthing process knew no social barriers. This created a rather macabre irony. The privileged had marginally better surroundings, but the threat still loomed. The differences in the survival rates of mothers across social classes weren't significantly different. The available medical advancements were woefully inadequate to bridge the gap. The underlying reality remained unchanged. For both the peasant woman and the noble lady, childbirth was a trial by fire, a harrowing journey into the realm of potential death, regardless of social status. A slight improvement in hygiene would have provided better outcomes, yet the lack of understanding in basic sanitation, a vital element in reducing infections, made the difference minimal. This was a universal truth, a stark reality shared by all women in that era, a constant and terrible reminder of their vulnerability. Then there were the cases that defied expectations. Gisolda, a young peasant woman, survived multiple pregnancies, her body seemingly untouched by the horrors that claimed so many others. Her story, however, was less a testament to medical prowess and more an act of sheer incredible luck. Her survival was an anomaly, a testament to the inexplicable randomness of life and death in the medieval world. Her existence did not alter the statistical reality of the situation, but it did offer a sliver of hope amidst an era characterized by its brutal indifference towards the maternal mortality rate. These stories, Ilara's faith, Thomas's sterile dread, Benedict's peaceful acceptance, and the myriad experiences of countless women facing the terrors of childbirth, are not just historical accounts, but chilling, poignant reminders of the human capacity for resilience in the face of overwhelming odds. The medieval world, with its crude tools, its superstitious practices, and its astonishing indifference to maternal mortality reveals a terrifying yet strangely fascinating glimpse into the brutal reality of life and death, especially for women. Their struggles, their fears, their unwavering faith, and their extraordinary courage deserve to be remembered not just as footnotes in the history of medicine, but as powerful testaments to the enduring human spirit, a spirit often tested to the absolute limit. These women, lost to the annals of history, yet vital to the continuations of their lineage, deserve our recognition and remembrance, not just as historical figures, but as powerful symbols of survival, a quiet rebellion against the grim realities of their time. The silence surrounding their deaths was loud. Their experiences, though undocumented in many cases, were no less profound or vital to understanding the human condition. Their stories, pieced together from scattered records and fragments of knowledge, paint a vivid picture of an era characterized by its brutality, yet strangely touched by glimmers of hope and unexpected resilience. The rasping cough that racked Thomas's body was a constant, unwelcome companion. It wasn't the elegant, refined cough of a nobleman afflicted with a delicate lung ailment. This was the raw, guttural sound of a man whose chest cavity had been violated, crudely stitched, and left to heal itself as best it could. The barber surgeon, bless his calloused hands, had removed the arrowhead with a skill bordering on barbaric grace, but the infection that followed had nearly claimed his life. Now, months later, he was left with a scar that snaked across his ribs, a permanent reminder of his brush with death. The scar tissue was a tight, ropey landscape, a testament to the body's frantic attempts to repair itself with whatever limited resources it possessed. It itched incessantly, a constant torment, particularly when the weather turned cold and damp. He wasn't alone in his suffering. Across the kingdom, countless others bore the scars of medieval surgery, a brutal tapestry woven from infection, pain, and often permanent disability. The simple act of surviving a procedure often meant a life irrevocably altered. Brother Benedict, miraculously spared from the full force of the plague, now walked with a pronounced limp, his leg forever shortened by the crude amputation he had undergone. The monastery, once a sanctuary of peace and quiet contemplation, was now a poignant reminder of his lost mobility. The simple act of traversing the cloisters, once a meditative practice, now required a concentrated effort, each step a minor victory against the persistent ache in his remaining leg. His once delicate hands, once skilled at illuminating manuscripts, now trembled slightly, a legacy of the fever that had nearly consumed him. The pious acceptance he exuded masked a deep, almost invisible sadness, the quiet sorrow of a life irrevocably changed. Agnes, the village healer, was accustomed to tending wounds, both physical and emotional, but even her considerable resilience was tested by the aftermath of the brutal accident that had shattered her arm. The bones, imperfectly set by a traveling bone setter whose knowledge was as sketchy as his hygiene, had knit themselves back together, leaving her with a crooked, painful limb. The constant throbbing, the aching stiffness, was an unavoidable reality, a constant reminder of her fragility. She treated her patients with the same patient stoicism that she herself maintained, though the daily grind of her work was made considerably more difficult. Her herbs and remedies could ease some symptoms, but they couldn't erase the physical limitations she now faced, limitations that cast a shadow on her ability to continue her work. Ilara, the young woman who had survived the brutal childbirth that had claimed so many others, bore her own burden. The ordeal had left her weak and pale, a fragile shell of the vibrant woman she once was. While the child thrived, Ilara struggled. She suffered from a persistent, debilitating pain that no amount of herbal remedies could alleviate. The sheer agony, a dull throbbing that accompanied her every movement, was a constant reminder of the ordeal that had tested her to her limits. She was a survivor, undoubtedly, yet her survival came at a cost measured in pain, weariness, and a constant, lingering fear. The sheer fatigue dominated her days, her movements slow and hesitant, her energy sapped by the invisible wounds that lingered long after the physical trauma had subsided. Many didn't even survive long enough to face the consequences of their injuries. The mortality rate following surgery was appallingly high. The patients didn't just face the immediate risks of the procedure itself. The risk of infection was a constant looming threat. In an era before antiseptics and antibiotics, even the simplest wound could become a gateway to a fatal infection. Sepsis, the body's overwhelming response to infection, was a common and horrific killer, leaving behind a trail of death and devastation. The absence of basic hygiene in many surgical settings further amplified the risk. The barber surgeons, despite their supposed skill, were working in conditions that were far from sterile. The tools used were often crude and unsterile, contributing to the high rates of infection. Imagine the rusty saw slicing through flesh, the dirty forceps tearing at tissue, the unwashed hands of the surgeon handling open wounds. This was not a sterile operating room. It was often a dirty, chaotic scene where the line between surgical intervention and death was often blurred. The consequences of these unsanitary practices were devastating and often fatal. Consider the story of a young boy who underwent a trepanation, a procedure where a portion of the skull was removed. The aim was to relieve pressure on the brain, a procedure that in its modern iteration can be life-saving. However, in the medieval world, it was fraught with risk. The lack of sterile tools and the crude techniques meant that the boy's survival chances were severely diminished. Even if he managed to survive the initial procedure, he faced a high probability of infection, leading to pain, fever, and potentially death. Even if he survived that, the visible and permanent nature of the surgery would mark him forever. His existence would be permanently changed. The social implications of scarring and disability were immense. In a society that placed a high value on physical strength and ability, individuals with permanent injuries faced significant social stigma. A man with a crippled leg was less likely to find employment. A woman with a disfigured face could find herself ostracized. Their disabilities were not merely physical, but often manifested as social and economic hardships. This was not simply a matter of physical pain. It was a question of survival and social acceptance. The challenges they faced extended far beyond their physical wounds and often impacted their prospects for marriage, employment, and overall social integration. The religious context also played a role. Some saw disability as a punishment from God, a manifestation of divine wrath. Others viewed it through the lens of charity and compassion. The church offered spiritual solace and a sense of community, but it couldn't mitigate the physical realities of life after a surgical intervention. The impact of surgery, therefore, wasn't just physical, but deeply intertwined with the spiritual and social fabric of the medieval world. These stories, however bleak, were not solely tales of suffering. They were narratives of resilience, of the human spirit's capacity to endure unspeakable pain. They were stories of adaptation, of the remarkable ways in which individuals found a way to navigate a world that often seemed determined to undermine them. Even amidst the suffering, there were moments of quiet triumph, a limp adjusted, a scar tended, a life somehow reinvented in the face of overwhelming odds. The stories of those who survived the horrors of medieval surgery were testaments to the human spirit's enduring capacity to not merely endure, but to find a way to thrive, even in the face of adversity. They were testaments to resilience, to the unwavering human will to live, to survive, and to find a measure of peace, even in a world where peace was often a luxury rarely afforded. Their scars, both visible and invisible, bore witness to their incredible struggles and the extraordinary strength they possessed. The battlefield reeked of blood, sweat, and something far more sinister, the cloying sweetness of decay. Sir Reginald, a knight renowned for his valor, lay amidst the carnage, his leg a mangled mess of bone and torn flesh, the result of a brutal cavalry charge. His screams, initially piercing, had dwindled to pained whimpers, his strength ebbing away with every drop of blood. His fellow knights, faces grim with a mixture of fear and grim determination, looked on, their own wounds a testament to the day's brutal cost. Death was a constant companion on this blood-soaked field, and Reginald's chances of joining it seemed exceptionally high. The army surgeon, a man named Master Elias, approached cautiously. Elias wasn't exactly a medical marvel. His training was a chaotic blend of battlefield experience and haphazardly acquired knowledge. He had learned more from the gruesome realities of war than from any formal schooling. His kit, a collection of rusty saws, blunt knives, and strangely inadequate implements, would make a modern surgeon shudder. Yet, he was the only hope for the gravely wounded knight. The procedure was brutal, a dance of pain and desperate hope. There was no anesthesia, only the knight's raw courage and Elias's grim efficiency. The sound of the saw cutting through bone, the sickening tearing of flesh, these were the sounds of survival. Elias's hands, though calloused and stained, moved with surprising precision, guiding the saw with a practiced hand, somehow avoiding major arteries and nerves. The stench was overpowering, a nauseating blend of blood and decaying flesh. Yet Elias pressed on, driven by a dark determination honed by years of battlefield butchery. After what felt like an eternity, the amputation was complete. The severed leg was discarded unceremoniously, another grim offering to the battlefield's morbid harvest. Elias worked quickly, cauterizing the wound with a heated iron, a process both painful and surprisingly effective in staunching the bleeding. He then, with a grim sense of improvisation, used strips of linen soaked in a questionable concoction of herbs and wine to dress the wound. It wasn't sterile, certainly, not by any modern standard, but it was the best Elias could offer. Against all odds, Sir Reginald survived. Not only that, but he made an astonishing recovery. His survival wasn't down to divine intervention or some miraculous medieval cure. It was down to a combination of luck, a surprisingly skilled surgeon for the time, and the knight's remarkably robust constitution. The infection that almost certainly would have claimed countless others spared him. He was exceptionally fortunate to escape the septicemia that was often the grim reaper in those days. His scar, a thick, jagged reminder of his brush with death, became a badge of honor, a testament to his resilience and Elias's unusual competence. While his ability to ride was gone, he lived, a fact that proved much more valuable than any leg. This was an anomaly, certainly, yet it proved that even within the brutality of medieval medicine, sometimes a miracle of sorts could happen. Another remarkable case involved Lady Annalise, a noblewoman afflicted with a severe case of what we now understand to be appendicitis. Her symptoms, excruciating abdominal pain, fever, and vomiting, left her confined to bed, her life hanging precariously in the balance. The local physician, a man with a reputation for more superstition than skill, had prescribed various herbal concoctions and bloodletting, treatments that only worsened her condition. Fortunately, a traveling surgeon, a woman named Mistress Ilara, happened to be visiting the castle. Ilara was a radical for her time, possessing some understanding of anatomy that was relatively unusual for a surgeon of the period. This came from a combination of practical field experience combined with a surprisingly deep understanding of ancient texts and learned treatises. She diagnosed Lady Annalise's condition accurately. This was in no small part thanks to her keen observation of the symptoms and the thorough examination she performed. It should be stated that in the vast majority of medieval instances, such an examination may well have made matters much worse. Ilara's approach was unconventional. Rather than using the typical medieval treatment, she performed a rudimentary surgery, meticulously cutting into Lady Annalise's abdomen. Again, we are far from antiseptic standards, but the surgeon's surgical skills were much better than many of her medieval peers. She identified and removed the infected appendix using crude instruments. While the process was painful and fraught with danger, she used surprisingly effective surgical techniques to minimize the impact on other organs. The surgery was a success. Ilara used a unique blend of herbs and carefully applied dressings to reduce infection and promote healing. Lady Annalise, initially weak and in considerable pain, made a remarkable recovery, her life saved by a combination of observation, competence, and a hefty dose of good fortune. These instances of success stand out starkly against the backdrop of medieval medical catastrophes. They highlight the significant role that luck and basic observation played in medieval medicine. It wasn't about advanced medical knowledge. It was often about being in the right place at the right time, with a surgeon who possessed an unusual blend of skill, intuition, and a remarkably high tolerance for the gruesome realities of medieval surgery. It's important to remember that these were exceptions, not the rule. For every success story, countless others ended tragically, highlighting the perilous reality of medieval healthcare. But they underscore a compelling truth. Even in the face of daunting limitations, human ingenuity and resilience found ways to shine through, proving that even amidst the crudest of practices, hope could occasionally bloom, and sometimes, even against all odds, lives could be saved. The crude saws and rusty instruments might not have made for a pretty picture, but they did, on rare occasions, lead to remarkably positive results. The stories of survival from that era, rare as they were, offer a unique and compelling look into the remarkable resilience of the human spirit and the often unexpected twists and turns of the medical history of the medieval world. The contrast between the successes and failures also serves as a powerful reminder of the incredible advances in medical technology and understanding that have taken place since that time. Chapter 3: Lessons from the Lancet. Then and Now. The stark contrast between Master Elias's rudimentary amputation kit and the gleaming stainless steel instruments of a modern operating room is a visual representation of the chasm separating medieval and modern surgery. Imagine Elias, his hands stained with a mixture of blood and dubious herbal concoctions, wielding a rusty saw near Sir Reginald's leg. Now picture a modern surgical team, clad in sterile gowns and masks, utilizing laser scalpels and advanced imaging technology. The difference isn't just aesthetic, it represents a fundamental shift in understanding, technique, and outcome. In the medieval world, the concept of hygiene, as we understand it, was practically non-existent. Sterile environments were unimaginable. Operating theaters, if they could even be called that, were often dingy rooms, permeated with the stench of unwashed bodies, decaying matter, and the ever-present aroma of infection. Even the most skilled surgeons, like Mistress Alara, worked in conditions that would induce a modern surgeon to flee in horror. The very idea of sterilizing instruments was absent. The tools of the trade were often repurposed, cleaned with questionable methods, or simply wiped on the surgeon's apron. This resulted in infections that were frequently fatal. Septicemia, tetanus, and gangrene were constant deadly companions, often claiming more victims than the initial injury itself. Post-operative infections represented a significant cause of mortality, eclipsing any chance of survival in the vast majority of cases. The absence of anesthesia in medieval times meant that surgery was a terrifying ordeal. Patients endured unimaginable pain, relying only on their own grit and the surgeon's speed. Modern anesthesiology, with its precise control of pain and sedation, is an unimaginable luxury compared to the medieval experience. Even in the best case scenarios, the patient's own fortitude could often be their only solace during the procedure. The sounds of medieval surgery, the rasp of the saw, the tearing of flesh, the patient's screams, must have been horrific. Contrast this with the quiet efficiency and relative calm of a modern operating room, where the patient is often pain-free and unaware of the procedure. The psychological impact alone represents a massive leap forward for modern medicine. The advancements in surgical instruments are equally staggering. Elias's rusty saws and blunt knives bear little resemblance to the precision instruments used today. Modern scalpels, microsurgical tools, and robotic surgery systems allow for incredibly delicate procedures with minimal tissue damage. The development of specialized instruments for specific procedures, from heart surgery to neurosurgery, has revolutionized the possibilities of surgical intervention. Furthermore, the introduction of materials like titanium and polymers for implants has significantly improved the longevity and compatibility of artificial replacements. Beyond instrumentation and hygiene, the understanding of anatomy and physiology has undergone a radical transformation. Medieval surgeons possessed a limited understanding of the body's intricate workings. Their knowledge was often gleaned from the limited dissections they could perform or from the writings of ancient Greek physicians, frequently misinterpreted or outright incorrect. Their reliance on guesswork and intuition could be deadly. Modern surgeons, armed with detailed anatomical knowledge and advanced imaging techniques like X-rays, CT scans, and MRIs, possess a level of precision unimaginable in the medieval era. They can visualize the internal structures with clarity, plan their incisions with exactitude, and minimize damage to surrounding tissues. The difference in mortality rates is perhaps the most stark indicator of the progress made in surgery. While it's impossible to provide exact numbers for medieval surgery's fatality rates, it's safe to say that the majority of surgical interventions ended with the patient's demise. Even seemingly simple procedures carried a high risk of death from infection or complications. Modern surgery, while still carrying some risk, boasts significantly lower mortality rates due to advancements in anesthesia, hygiene, surgical techniques, and post-operative care. The sophisticated understanding of infections, combined with sterile conditions and the potent antibiotics at our disposal, mean that post-operative infections are far less common and far more effectively treated, allowing patients to recover and reducing the death rate dramatically. The sheer range of procedures possible today is another significant difference. Modern surgery can tackle complex medical issues previously unthinkable to treat. Organ transplants, minimally invasive procedures, and advanced reconstructive surgeries are but a few examples of the possibilities offered by modern surgical techniques. Medieval surgery was, by necessity, limited to relatively simple procedures like amputations and wound closures. The lack of knowledge and the limitations of tools severely restricted what could even be attempted. The comparison between medieval and modern surgery is not simply a matter of technological progress. It reflects a broader shift in scientific understanding and medical philosophy. The move from superstition and guesswork to evidence-based practice has profoundly transformed the field of surgery, dramatically increasing the safety and effectiveness of surgical interventions. While the medieval surgeons possessed a level of skill and resilience that deserves recognition, the advancements made since then have rendered their practices almost unrecognizable, highlighting the extraordinary progress made in the pursuit of medical science. The stories of survival in medieval times, while remarkable, were often exceptions that proved the rule. The vast majority of people undergoing surgery died. Modern advancements have transformed that grim reality. The lives saved, the suffering alleviated, and the sheer range of possibilities offered by modern surgery represent an incredible testament to the power of medical innovation and an ongoing dedication to improving patient outcomes. The contrast between the brutal reality of medieval surgery and the sophisticated procedures of today stands as a powerful reminder of the incredible journey medical science has undertaken. The transition from the bloodletting basins and rusty saws of medieval surgery to the sterile operating theaters and laser scalpels of today is a journey spanning centuries, punctuated by breakthroughs that seem almost miraculous in retrospect. It's a narrative not just of technological advancement, but of a profound shift in understanding the very nature of the human body and disease. To fully grasp the magnitude of this change, we must delve into the evolution of medical knowledge itself. The medieval worldview, profoundly shaped by Galen and the humoral theory, viewed the body as a complex interplay of four humors: blood, phlegm, yellow bile, and black bile. Illness was understood as an imbalance of these humors, and treatment often involved restoring this equilibrium through methods that, to modern eyes, appear bizarre at best and barbaric at worst. Bloodletting, purging, and even induced vomiting were common practices, employed with an almost religious fervor, regardless of the patient's actual condition. The idea of a specific pathogen causing disease was entirely absent. Instead, imbalances in the cosmic order or divine retribution were often blamed. This lack of understanding meant that treatments were often as harmful as the diseases they aimed to cure. Consider the case of the king's evil, or scrofula, a tuberculous infection of the lymph nodes. Medieval treatments ranged from the application of supposedly miraculous relics to the ritualistic touch of a monarch believed to possess healing powers. While some individuals may have experienced spontaneous remission, the lack of effective treatment meant a high mortality rate. The very idea of identifying and eliminating the underlying bacterial cause was inconceivable. The Renaissance, while often romanticized, initially offered only incremental improvements. Anatomical knowledge gradually expanded thanks to the work of Andreas Vesalius, whose meticulous dissections challenged Galen's long-held anatomical inaccuracies. Vesalius's De Humani Corporis Fabrica, published in 1543, became a cornerstone of modern anatomy, providing a far more accurate and detailed understanding of human structure. However, even with improved anatomical understanding, the humoral theory persisted, hindering the development of effective treatments. A significant leap forward came with the advent of the microscope in the 17th century. Anton van Leeuwenhoek's observations of microorganisms opened up a whole new world, though their connection to disease wasn't immediately apparent. The groundwork for understanding the microbial world had been laid, but it would take another 2 centuries for its full implications to be realized. The 18th century witnessed continued advancements, including the development of more sophisticated surgical instruments and techniques. The use of antiseptic solutions, albeit rudimentary, began to improve surgical outcomes by reducing infection rates. However, the underlying causes of infection remained shrouded in mystery. The persistent belief in miasma, the theory that foul-smelling air caused disease, still held sway, preventing a full embrace of the germ theory. The 19th century marked a watershed moment in the history of medicine. The germ theories of disease, championed by Louis Pasteur and Robert Koch, finally overturned the humoral theory and miasma. Pasteur's experiments on fermentation and the discovery of microorganisms as the agents of disease revolutionized the understanding of infectious processes. Koch's postulates, a rigorous set of criteria for establishing a causal link between a microorganism and a specific disease, provided a scientific framework for identifying pathogens. These discoveries paved the way for the development of vaccines and antiseptic surgical techniques, ushering in an era of unprecedented advances in public health and surgical practice. The work of Joseph Lister, a pioneering surgeon, stands as a testament to the power of the germ theory. Lister's adoption of carbolic acid as an antiseptic dramatically reduced the incidence of post-operative infections, transforming surgical outcomes. His insistence on cleanliness and sterilization, considered radical at the time, laid the foundation for modern aseptic surgical techniques. The implications were profound. Surgery, once a terrifying and often fatal undertaking, was slowly becoming a safer and more effective procedure. The 20th century saw an explosion of medical discoveries. The development of antibiotics, beginning with penicillin, revolutionized the treatment of bacterial infections. The discovery of X-rays, CT scans, and MRI technology provided unprecedented insights into the human body's internal structures. These advances, coupled with the development of sophisticated surgical tools and techniques, opened up a new era of medical possibilities. Organ transplantation, heart surgery, neurosurgery, procedures that were once unimaginable became commonplace. The development of anesthesiology transformed surgery from a brutal, agonizing ordeal into a relatively painless procedure. The ability to control pain and patient consciousness fundamentally altered the surgical landscape, allowing for more complex and longer procedures. The advancements in post-operative care, including advanced pain management techniques, also significantly reduced mortality rates and improved patient outcomes. The evolution of medical knowledge is far from over. Ongoing research continues to push the boundaries of medical science, leading to new discoveries and advancements in diagnostics, treatments, and surgical techniques. From gene therapy to advanced robotic surgery, the possibilities seem almost limitless. The stark contrast between the medieval belief in humors and the modern understanding of the human genome underscores the astonishing progress made. The path from the crude, often lethal practices of medieval surgery to the sophisticated, life-saving procedures of today is a testament to human ingenuity, perseverance, and the relentless pursuit of knowledge. A journey marked by both breathtaking progress and darkly humorous retrospectives on what was once considered medical expertise. The lessons learned from the past should serve not only as cautionary tales, but also as a source of inspiration, driving us towards a future of ever-improving medical care. The echoes of medieval medicine, though faint, still resonate in the operating rooms and clinics of the 21st century. It's not just a matter of quaint historical curiosity. The legacy of that era continues to shape our understanding of health, illness, and the very nature of medical practice. To understand this enduring influence, we must move beyond the rusty scalpels and leeches and delve into the less obvious, yet equally significant, ramifications of centuries of medical evolution. One of the most striking legacies is the enduring power of placebo effect. While modern medicine painstakingly strives to isolate and quantify the effects of treatments, the medieval reliance on faith, ritual, and suggestion wasn't entirely ineffective. The king's evil, for example, saw remarkable cures through the royal touch, a testament to the potent power of belief and expectation. This isn't to suggest we should return to anointing monarchs. Rather, it highlights a crucial, often overlooked aspect of healing: the mind-body connection. Modern medicine, while scientifically rigorous, is beginning to fully appreciate the integral role of the patient's psychological state in their recovery. Placebo-controlled trials, for example, meticulously measure the impact of belief on treatment outcomes, showcasing the remarkable power of the mind to influence the body's healing process. A legacy, in a twisted sense, of the medieval belief in the power of the sacred touch. Conversely, the enduring suspicion of certain medical practices rooted in medieval anxieties continues to pose significant challenges. The distrust of vaccinations, for instance, bears a chilling resemblance to the medieval fear of miasmatic contagion. While the medieval fear of foul air led to illogical and ineffective practices, the modern anxieties surrounding vaccinations, often fueled by misinformation and unfounded claims, lead to real-world consequences, outbreaks of preventable diseases. The historical parallels, though unsettling, offer valuable insight into the psychological factors that influence acceptance of scientific advancements. Overcoming this distrust requires not simply presenting scientific facts, but also engaging with the deeply ingrained historical and cultural anxieties that perpetuate vaccine hesitancy. Addressing these fears requires a nuanced approach that recognizes the historical context of medical mistrust and acknowledges the anxieties underlying vaccine skepticism. The medieval fascination with herbal remedies also has a surprisingly modern parallel. While the efficacy of many medieval herbal concoctions was questionable at best, the modern interest in herbal medicine and alternative therapies echoes a centuries-old desire for natural healing. This doesn't mean discarding modern medicine for dandelion tea. Rather, it highlights a persistent human desire for holistic, personalized approaches to healthcare. Modern integrative medicine is beginning to bridge the gap between traditional and alternative therapies, demonstrating a recognition that a multifaceted approach, blending scientific rigor with patient-centric approaches, can offer comprehensive and effective treatment. Furthermore, the medieval emphasis on the humoral theory, though fundamentally flawed, had a surprising influence on dietary practices. The belief in balancing the four humors contributed, however indirectly, to a focus on dietary balance and the importance of lifestyle in maintaining health. This emphasis on nutrition, albeit based on a fundamentally inaccurate understanding of physiology, foreshadowed the modern understanding of diet's crucial role in health and disease prevention. Today's emphasis on a balanced diet, regular exercise, and stress management are, in a way, distant echoes of medieval attempts to maintain the equilibrium of humors, a reminder that some intuitive notions, even if based on faulty premises, may hold kernels of truth. The cultural and societal implications of medical history are just as profound as the purely scientific ones. The history of medicine in the Middle Ages, for instance, often reflects social inequalities. The wealthy had access to better care, often involving treatments that were just as ineffective, though more expensive, than those available to the poor. This stark disparity has a disturbing resonance in modern healthcare systems, where access to quality care is often determined by socioeconomic status. Examining the past reveals the persistent and insidious nature of healthcare inequality, offering valuable lessons for building more equitable and just healthcare systems. The legacy of medieval medicine isn't simply about the primitive tools and procedures. It's also about the social and political factors that continue to shape access to healthcare in the 21st century. Medieval views on contagion also offer insights into modern epidemiology. While the germ theory revolutionized our understanding of infectious diseases, the medieval focus on quarantines and isolation, though born out of fear and misunderstanding, laid the groundwork for modern public health strategies. The historical record offers stark reminders of the devastating consequences of uncontrolled epidemics, underscoring the critical importance of preventive measures and coordinated public health responses, lessons learned, albeit painfully, from the past. The enduring legacy of medieval medicine isn't a straightforward narrative of progress. It's a complex interplay of archaic practices, misguided beliefs, and surprising prescience. It's a reminder that even the most seemingly primitive approaches to medicine can hold unexpected lessons. The absurdity of some medieval practices provides a darkly comedic backdrop for examining the evolution of medical knowledge, while the enduring power of the placebo effect and the persistence of certain anxieties highlight the complexities of human health and the challenges of bridging the gap between science and belief. The history of medicine offers not just a cautionary tale, but a valuable lens through which to examine the present and shape the future of medical practice. It's a narrative that reminds us that while the tools and techniques of medicine have evolved dramatically, the fundamental human needs for healing, comfort, and hope remain timeless, and, perhaps surprisingly, sometimes even share threads with beliefs and practices of bygone eras. The past, even the darkly humorous past of medieval medicine, holds invaluable lessons for the future of healthcare. Ignoring it would be not only foolish, but potentially harmful. The starkest contrast between medieval and modern medicine isn't simply the difference between rusty scalpels and laser surgery. It lies in the chasm separating their ethical frameworks. Imagine, if you will, a medieval surgeon, let's call him, for the sake of argument, Giles, preparing to amputate a leg. Informed consent, a laughable concept. Patient autonomy, non-existent. Giles, likely fueled by ale and a hefty dose of superstition, would probably proceed with the amputation based on his own judgment, the patient's screams serving as a less than ideal form of feedback. Pain management? Forget about it. The idea of anesthesia was centuries away, and the patient's suffering was simply accepted as an unavoidable part of the process, a grim testament to the era's callous disregard for human suffering. The closest thing to an ethical code was perhaps a vague adherence to the Hippocratic Oath, but even that was often twisted to suit the circumstances. Modern medical ethics, while far from perfect, represent a monumental shift. The cornerstone of this new ethical framework is the concept of informed consent. Before a surgeon even picks up a scalpel today, the patient must be fully informed of the procedure, the risks involved, and the potential alternatives. They must understand what's happening to their body and agree to the intervention. This fundamental right to have a say in one's own medical treatment is a testament to centuries of struggles for patient autonomy, a concept utterly alien to Giles and his medieval counterparts. The very idea of the patient as an active participant in their care, rather than a passive recipient of whatever treatment the physician deemed necessary, is a dramatic evolution. This shift towards patient autonomy hasn't been without its difficulties. The very act of obtaining fully informed consent can be complex. Patients may not fully grasp the medical jargon, or they may be emotionally distraught, unable to make rational decisions. This has led to intense debates about the capacity for consent, the role of family members in decision making, and the limits of patient autonomy when the patient's choices may seem harmful to themselves. The complexities of informed consent represent a significant challenge within modern healthcare, a challenge that highlights both its strengths and its limitations. The ethical framework of modern medicine also places a high premium on minimizing pain and suffering. Anesthesia, analgesics, and a focus on patient comfort are not mere luxuries, but fundamental aspects of ethical medical practice. This isn't just about avoiding unnecessary pain. It also recognizes the proven impact of pain on recovery and overall well-being. The contrast to medieval approaches, where pain was viewed as an inevitable, even deserved part of illness, is stark. The shift in perspective underscores the remarkable progress in understanding the psychological and physiological ramifications of pain and the importance of providing comfort and dignity to the suffering patient. Another critical aspect of modern medical ethics is the concept of confidentiality. The relationship between a doctor and patient is based on trust, and this trust hinges on the assurance that personal information will be protected. Breaching patient confidentiality is not only unethical, but often illegal. This notion was remarkably absent in the medieval era. Medical information was often shared freely, with little regard for the patient's privacy. The modern insistence on patient confidentiality represents a profound change in the way society views medical information and the need to respect individual dignity. The Hippocratic Oath, while ancient, continues to serve as a foundational ethical guidepost for many medical professionals. Its core principles, beneficence, non-maleficence, respect for autonomy, and justice, remain relevant, though their application has evolved considerably over time. The original oath, with its emphasis on physician paternalism, has been subjected to significant reinterpretations to reflect modern values. The ethical dilemmas posed by medical advancements, such as genetic engineering and artificial intelligence in healthcare, necessitate ongoing discussions about the ethical boundaries of medical practice. The ethical considerations surrounding these advancements are not merely academic exercises. They have real-world implications for how medicine is practiced and how resources are allocated. Consider the case of organ transplantation. The development of successful organ transplantation procedures has created a myriad of ethical issues. The need to balance the desperate need for organs with the moral questions concerning the source of these organs, cadaveric donation versus living donation, has generated complex ethical debates. Similar considerations apply to the use of artificial intelligence in diagnostics and treatment planning. The potential for bias in algorithms, the need for transparency in AI-driven medical decisions, and the question of who is ultimately responsible for medical errors involving AI are all ethical challenges that demand careful consideration. These ethical considerations underscore the dynamic nature of medical ethics and the ongoing need for reflection and adaptation. Furthermore, the question of access to healthcare is a deeply ethical one with profound historical roots. The disparities in access to care during the medieval era were primarily determined by wealth and social status. This inequality persists today, though the reasons are more complex. The ethical implications of healthcare disparities are immense. The question of whether healthcare is a right or a privilege, and how societies should allocate limited resources, remains a central theme in discussions about healthcare ethics. The allocation of healthcare resources, especially in the face of limited budgets and an aging population, poses an ongoing ethical challenge. Decisions regarding funding for research, drug pricing, and access to specialized care often involve trade-offs that necessitate careful ethical analysis. It's a discussion that involves not just medical ethicists, but also economists, policymakers, and the general public. Modern medical ethics grapples with complex issues beyond individual patient care. The ethics of clinical research and the protection of vulnerable populations during research studies have become increasingly important. The ethical principles of informed consent, minimizing risk, and ensuring equitable distribution of benefits and burdens apply equally to research contexts as they do to clinical settings. The history of unethical medical research, including horrific examples of experimentation on vulnerable groups, serves as a cautionary tale. These historical transgressions underscore the importance of robust ethical review boards and the need for rigorous adherence to ethical guidelines in research involving human subjects. The evolution of medical ethics is a journey, not a destination. The contrast between the stark pragmatism, if not brutality, of medieval surgical practices and the nuanced ethical complexities of modern healthcare reflects a profound shift in societal values, scientific understanding, and the doctor-patient relationship. While the tools and techniques have changed dramatically, the fundamental questions about what constitutes good medical practice and how best to balance the competing interests of patients, physicians, and society remain timeless. The lessons from the past, both the gruesome and the illuminating, serve as a critical foundation for navigating the ethical challenges of the future. The dark humor of medieval medicine serves as a reminder of how far we've come and how far we still have to go in ensuring that ethical principles truly guide the practice of medicine. The transition from the haphazard slash and burn approach of medieval surgery to the precise, technologically advanced procedures of modern medicine is a story not just of technological advancement, but of professional evolution. Picture, if you will, a dimly lit, pungent shop in 14th century London. The air hangs heavy with the smells of herbs, blood, and unwashed linen. This isn't a pharmacy, it's a barber surgeon's shop, a place where the line between hair trimming and limb amputation was surprisingly blurry. The surgeon, likely a man with more experience wielding a razor than a scalpel, performs a tooth extraction with a pair of rusty pliers, the patient's cries echoing through the cramped space. There's little in the way of sterile technique. The tools are wiped on a rag, if they're wiped at all, and the patient's chances of survival hinge less on skill and more on sheer luck and the resilience of the human body. This was the reality for most medieval surgical interventions. The profession wasn't regulated, specialized knowledge was scarce, and training consisted largely of apprenticeship, often under someone with questionable expertise. The barber surgeon, a ubiquitous figure throughout Europe, often held the dubious honor of performing the most invasive procedures. Their dual role reflected the rudimentary understanding of the human body. The art of bloodletting, considered a crucial part of medical practice, was closely intertwined with the more superficial practice of barbering. Ironically, the barber's skills in handling sharp instruments and making incisions proved surprisingly transferable to the somewhat less refined art of surgery. The tools of the trade were rudimentary at best, reflecting both the limited technological capacity and the overall philosophy of the time. Saws, knives, and cauterizing irons were the instruments of choice, offering less precision and significantly greater risk of infection than their modern counterparts. Anesthesia, as we understand it, was non existent. Pain management relied on potent concoctions of questionable effectiveness, leaving patients to endure their ordeal with little more than gritted teeth and perhaps a generous dose of strong ale. Survival, in many cases, was a matter of sheer fortitude and a healthy dose of luck. The contrast with a modern operating room is, to put it mildly, jarring. Step into a contemporary surgical suite, and you're greeted by a sterile environment, a symphony of beeping machines, and a team of highly specialized professionals, each with a specific and crucial role. The surgeon, a product of years of rigorous education and training, commands a sophisticated arsenal of tools, from minimally invasive laparoscopes to laser scalpels. Advanced imaging techniques provide a detailed view of the surgical field, while sophisticated monitoring equipment ensures the patient's vital signs are closely tracked. Anesthesia provides pain relief and muscle relaxation, while the entire surgical team works in a coordinated dance to ensure a safe and effective procedure. Post-operative care, involving advanced pain management, infection control, and rehabilitation, significantly improves the chances of a successful outcome. The transition from the barber surgeon's shop to the modern operating room reflects a profound shift in the understanding of the human body, the evolution of surgical techniques, and the establishment of a regulated medical profession. The rise of medical schools, starting in the medieval period but accelerating significantly in the Renaissance and beyond, was instrumental in this transformation. These institutions, initially offering a more holistic approach encompassing medicine, surgery, and pharmacology, gradually moved towards specialization, ultimately leading to the highly specialized surgical subdisciplines we see today. The formalization of surgical training was a crucial aspect of this process. The apprenticeship model, while possessing a certain hands-on appeal, lacked the structured curriculum and rigorous standards necessary for consistent quality and safety. Medical schools began to standardize training, establishing curricula, offering standardized exams, and gradually implementing licensing requirements. This marked a significant improvement over the chaotic landscape of unregulated practitioners. Licensing, in turn, served to protect the public from incompetent or malicious practitioners, ensuring a level of accountability that was previously absent. The development of surgical techniques is another critical element in this story. The gradual understanding of anatomy, driven by advances in anatomical research and medical illustration, enabled surgeons to move beyond a purely empirical approach. Dissecting corpses, a practice initially frowned upon, became an essential part of surgical education, allowing surgeons to develop a more precise understanding of the body's inner workings. This shift from empiricism to scientific understanding was crucial in reducing surgical mortality and morbidity. The 19th and 20th centuries witnessed an explosion of surgical innovation. The discovery of anesthesia, a game changer that effectively removed a major obstacle to surgical intervention, was a pivotal moment. Antisepsis and asepsis techniques, spearheaded by figures like Joseph Lister, revolutionized surgical practice by reducing the risk of infection, which was previously the biggest threat to patients. The development of new instruments and technologies, from improved scalpels and sutures to sophisticated imaging techniques and minimally invasive surgical approaches, further enhanced the safety and effectiveness of surgical procedures. The rise of surgical specialties is also a crucial part of this professional evolution. Instead of a single practitioner handling everything from a tooth extraction to a complex abdominal operation, surgeons began to specialize, each focusing on a particular area of the body or a specific surgical technique. This specialization, combined with advances in medical technology, has led to incredible advancements in the treatment of a wide range of conditions, from heart surgery and neurosurgery to transplantation and robotic-assisted surgery. However, the professional evolution of surgery isn't without its complexities and ongoing challenges. Ethical considerations, particularly informed consent and patient autonomy, are crucial aspects of modern surgical practice. The regulatory landscape continues to evolve, adapting to new challenges and the ever-changing landscape of medical technology and ethical dilemmas. The ongoing refinement of training and continuing medical education keeps surgeons abreast of the latest advancements, ensuring the provisions of the highest quality of care. The ongoing development of ethical guidelines and regulatory frameworks attempts to balance the advancements in surgical technology with patient safety and well-being. From the dimly lit barber surgeon's shop to the gleaming modern operating room, the journey of surgery is a testament to the enduring human desire to alleviate suffering and improve lives. It's a story of incremental progress, punctuated by moments of profound breakthrough and marked by a constant tension between innovation and the ethical implications of such advancements. It's a story that, even with all its advancements, still retains a lingering hint of the dark humor that characterized its medieval origins, a stark reminder of how far we have come and the ongoing need for vigilance in the pursuit of excellence and ethical conduct in surgical practice. The laughter, perhaps, is less nervous now than it was in the days of Giles and his rusty pliers, but the gravity of the work remains the same.